Throughout the month of October, we've been sharing information for breast cancer screenings and stories of survivors. Wheels for Women is the country's first and only free transportation program dedicated to breast cancer screenings and diagnostics. So I am joined by Stacey Woods, who is the Director of Operations at Breast Care for Washington, along with the CEO of the Brem Foundation, Claire Doherty. Thank you, ladies, both so much for being here.
No, thanks for having us.
Such an important topic and even more important mission that you all are on. Congrats on milestone, 1,000 rides, yes. Right? Why is something like this program so important for our community?
Yeah, well, I would say that breast cancer is one of the leading causes, second leading cause of cancer death in the Washington, D.C. area. And unfortunately, Washington, D.C. has one of the highest death rates from breast cancer across the country. So we work really hard to make sure that women are able to access early detection. We know that early detection saves lives, but unfortunately there are a variety of barriers that exist for women to access those early detection services. So we work with local partners to identify women who are unable to travel to their breast screening appointments, and we work to set up rides for them.
That is incredible. And I know, too, for Breast Care for Washington, strategically placed in an area that is accessible to many people that wouldn't have had access to mammograms, free mammograms either. What have you seen since you guys have come and built this up in the D.C. area?
Well, for us, we can see that there's more volume of patients that's coming in due to transportation, because that's one of the three barriers that we have in specifically Ward 8, and they provide at least 50% of the transportation for Ward 8, and so there are other barriers that's included in this, as not only transportation, but also communication, language, and for us, anxiety. When women come in, they want it not knowing the results that may result into cancer diagnosis. And so they're helping us to close the gap with just getting the transportation to and from.
Yeah, and you all were one of the first organizations to join Wheels for Women, yes. Right? I mean, it's so perfectly aligned from what I know about both of your organizations.
Yeah, we've had a long time partnership with Breast Care for Washington at the Brem Foundation. Yes. We love to hold hands with them as an organization, and I would say that Breast Care for Washington has deep ties in the community. Absolutely. And really strong patient navigators who can help to identify the women who need services, and then the Brem Foundation can step in and help fill those gaps. So it really is a great partnership, and one that we look forward to continuing to nurture.
Absolutely.
And probably even more so important now, we hear so much about during the pandemic, women putting off their screenings. So not only did you have the barriers before, but now, you know, the not being able to get in, and it's a backlog and whatnot. So are you seeing women come to you like, okay, or are you all reaching out to the community and being like, it's time, like we need to get our mammograms?
So we're actually doing both. We have patients that call us. We also have a list of patients from a year, 2 years ago, just during the pandemic time, that we're reaching out and saying it's time for your annual, you didn't make your diagnostic appointment, and then we schedule those appointments. And sometimes they say we don't have a ride, you know, I'm working, or I don't have child care. The other great thing about Breast Care for Washington is that we have a space where they can bring their kids. So if they actually get transportation from Lyft, they can bring their kids, and we have a space for them. So that's another barrier that we're also closing the gap on as well.
Yeah, we at the Brem Foundation have been working really hard to make sure that people understand how much fall off there was during COVID-19 for cancer screenings across the board, but in particular breast cancer screenings. And women really need to work to get their appointments back on the books. Yes. We saw recently with Katie Couric's diagnosis and discussion about her breast cancer that even waiting 6 additional months is really not a good idea.
Right.
Women should be getting screened, and especially if you have specific risk factors. If you have a family history of breast cancer or dense breast tissue, you really need to make sure that you're staying on top of your screenings and advocating for yourself and your breast health.
Well, we know, I mean, breast cancer diagnosis, any kind of health diagnosis is scary, but like you said, early detection makes that journey a lot easier, a lot smoother sometimes. I'm 2 times early detection here, so I can speak from the heart. How can women come find you and get the rides and figure out how, you know, they can get to you all for their mammograms?
Yeah. Do you want to go first?
Okay, so Breast Care for Washington, we're located on 4 Atlantic Street, Southwestern Washington, D.C., 20032, and our contact number is 202.
They can check you out
Okay.
online.
Check
They
it
can check you out online.
Yeah. And yes, I want to thank you for having us. I want to thank Stacy for your partnership, and we are thrilled for our Wheels for Women partnership with Lyft. And if you'd like to learn more about how you can support the Brem Foundation, come to bremfoundation.org to learn about risk factors and also how you can support the Wheels for Women program.
It's amazing what you ladies do, and taking the excuses out, taking the barriers out, and helping women live their best life. Thank you both so very much
Thanks,
for all of
Kristen.
your dedication and time.